People often ask me how birthing better skills developed. There's an assumption that I alone developed the skills, and that's not accurate. I'm a body worker, and I worked with pregnant families from the early 1970s, and I gave birth in 1970 first, and then in 1982. Birth was changing a lot in 1970. The skills-based methods of Lamaze and Bradley were taught in the United States. Lamaze was taught in probably almost every hospital, and a whole generation of fathers and mothers had used skills to work through the activity of birthing their baby within a relatively medicalized U.S. model of maternity care. When we talked, because mums and dads talked, we didn't always feel settled with the skills that were available. The Lamaze breathing, which was basically panting, was just dysfunctional. You ended up with a brown paper bag and getting hyperventilated. The Bradley method, in the nose, out the mouth, was fine as long as the woman didn't breathe in her nose and out her mouth and either moan or scream. The man was thinking, well, she's doing it right, in the nose and out the mouth. But the woman is going, but that's not what relaxed sounds like. So we wanted more adaptable skills, more adjustable skills, and broader skills. And we wanted those three things for our role as birthing women and for our partner's role as a birth coach. So we developed the breathing, the communication skills. And we also developed a lot of the soft skills. And the soft skills were about keeping labor progressing and how do you deal with pain? What do you do when you hate birth? What do you do when you're afraid of pain? So there were all sorts of questions around what do you do? Right? Some of those were in hindsight and some of those were looking forward. By the 1980s, the skills-based methods had totally disappeared because the natural birth movement now focused on choices. So we were all writing birth plans and telling our care providers what we wanted and didn't want, but we were no longer skilled, and our husbands were intentionally told not to coach and to just support a woman's choices. So childbirth changed dramatically in the United States 12 years after I'd had my first baby. And the families I was working with were different, but it was the same questions. What do you do? What happens if? What if I could have? Now, why were those questions still being asked 12 years later? Because something occurred towards the late 1970s, which had a profound impact on childbirth. Birth control, legal termination, women going into the workforce, families getting smaller, and more emphasis societally on the demand that babies survive birth. Whereas in 1970, when there was a 5% cesarean rate, we accepted what was normal, natural, and physiological, which could mean a fine birth or a tragic one. Nobody wanted a mother to die, and that's why emergency classical cesareans were performed. But it was still acceptable, as it had been worldwide throughout time, that babies die at birth. So in the 1980s, when society changed, then there was pressure put on the medical community because nobody wanted to have those long labors anymore. Nobody had liked them, and it just became unacceptable. And along with the birth control and the safe termination and women going into the workforce and families getting smaller, something had a profound impact on how we approach birth, and that was we started to wear bikinis. And I know for people that sounds, what is that? But think about it. Women who had had cesareans, some of them wanted to try for a VBAC. They had this ugly scar from their pubic bone to their navel. They didn't want that. They felt shame in their body. Having a VBAC in a classical cesarean is quite risky. Ruptured uterus. More pressure got put on the medical community. If we wanted shorter births, then we were more likely to have cesareans. And in fact, the cesarean tripled from 1970 to 1982. And it tripled on the contingency plan that the medical profession come up with a different incision for the cesarean so that we could have a VBAC and have it be safer, and that we would not be left with that ugly scar when we were wearing bikinis. And the bikini cut was developed. Doctors didn't make up that name. It was demand from us wearing bikinis. And so we didn't want to birth as long. Therefore, the birthing better skills that were developed in the 80s that mainly fathers developed were the body skills. And we increased the skills on the progression of labor because nobody wanted a long labor, and we had to figure out how not to have one. And that required us to pay attention to the 5 phases of every contraction and making certain that each contraction was effective, which had to do with the positions that we were in and how our baby responded to those positions. And our positions entirely had to do with our ability to open our body and keep it mobile and to pair our birth canal all the way through the 3 inches of the depth of our vagina. And so the birthing better body skills were developed in the 80s. And we were doing fine until the 1990s. And then men spoke up once again. And they were saying, look, we understand we can prepare her body from 24 weeks onward, but I'm 24 weeks into this pregnancy, which is 6 months, and I'm still having trouble keeping up with the changes. And men wanted to keep up with the changes, and women wanted men to. And so the Pregnancy Academy skills were developed by men for the 5 phases of pregnancy, from conception to 12 weeks, 12 to 24, 24 to 36, 36 to birth, and the birth, because you're still pregnant until your baby comes out. So there were 10 skills that fathers developed that mothers can use as well, and they morph through each of the 5 phases. And why is that important? Because birthing better families really wanted to have what we named the continuity of skilled self. We all came into pregnancy skilled, and then we fell into this black hole of pregnancy and birth preparation and birth and got spit out and expected to parent effectively. And a lot of us struggled with relationships because we didn't both share skills at birth, and fathers weren't doing much except being there, and women wanted more of them. And so we developed more skills. And why did we develop more skills? We said that at the beginning. We wanted a wider range of adaptable, adjustable, sustainable skills. And we wanted both birth skills and birth coaching skills that could be used in absolutely every birth. And why did we want that? Because the birth of our baby was important to us. And so our birth was important to us. And our birth was always going to be an activity that each of us had to do. And because it's an activity, if we can fill out that activity with effective skills, then we will birth better.